I'm Ed Highland. Welcome back to DDW TV. We're here in San Diego, and I'm joined by Dr. Mark Russo, who is with Carolina's Medical Center. Dr. Russo, thank you for coming by and sharing with us.
Thank you for having me.
We're talking about careers in hepatology. I guess kind of walk us through a day in the life, if you will, of a hepatologist.
Sure, we're going to have actually a presentation on this, and there'll be something that we'll discuss on Monday about the variety of career paths you can follow as a hepatologist. So when you ask me a day in the life, it really depends on which path you'll choose, which we'll sort of discuss in detail at the symposium. But you could choose a path in university medicine, private practice, hospital-based medicine, the VA, or industry. So as you can see, there's a wide variety. So to answer that question, you really have to focus down and come and listen to the lecture, of course.
And one of the things that we were talking about before we got started on the recording was how it's not really discussed quite as much, perhaps, as you would like to see in medical school. So there's a whole world out there that may not be as familiar as it should be for folks who are up and coming.
Yeah, I mean, I think as even medical students or residents, it's uncommon for them to really learn about the details of what a hepatologist is, but as they progress through their career and they do elective rotations, they may hear about it. But hepatology is such a neat field, what's going on right now in liver disease. You know, we've just recently cured hepatitis C. We're working on treatments, hopefully maybe even cures for non-alcoholic fatty liver disease. So hopefully as medical students and residents progress in their career, they'll get more exposure and really learn what a dynamic, interesting field this can be.
Tell us about how exciting it is. What do you find really exciting about the career path?
I mean, it's such a great field because you can be involved with clinical care and patients, and there's nothing that's the same every day. There's something different that you see every day. It's just so interesting. You can develop that long-term relationship with the patient. You're interested in research. There's plenty of research to do. You can be involved in clinical trials, one of the latest and greatest, most advanced treatments for liver disease, presenting at national meetings, for example. If you like education, you can be involved in and teaching medical students, residents, and fellows. And if you're more involved in clinical research and industry, there's career paths for that as well.
Is this something that you would be recommending to someone who perhaps has started a career path and decided, yeah, maybe this isn't the direction that I want it to go?
I would say absolutely take a good look at it because it probably is the career path you want to go. This is something that there's something for everybody. And also I will tell you, when you ask folks outside of medicine who are the most fun doctors to hang out with, it's always the hepatologist, because the hepatologist, they understand it's a work-life balance, and there's work, but there's also play, and it's important, as I found with many of my colleagues, not to just focus on work, but to also make sure that you're involved with your family and friends as well.
What advice are you giving to trainees now? I mean, what should they be doing, actively working or doing?
I think for trainees, you have to find you have to pursue a career path that you find meaningful and purposeful, and something that you really enjoy going to work every day. So that is something you should look forward to every day and not dread. And you're gonna find that in your mentors. You're gonna say, I am like that person. That person, they love medicine, they're dedicated, but also they understand that there's life outside of medicine, and they have hobbies, they're involved with their family, they're involved with their friends. So look for mentors who you want to emulate.
Can you discuss a little bit about, you touched on research and some of the exciting areas. Can you give us kind of a broad perspective of the time frame we have, but kind of a look at what someone can, light the fire, light the bulb for them that is going to get them perhaps interested in going in that direction through the world of research?
So are you curious? Are you a curious person? Do you like to write? Do you like to see your name on publications? Do you want to present? Do you want to interact with colleagues on some of the most interesting, novel things going on in medicine, in this case hepatology? Then that is something that you should pursue. You should pursue that curiosity in the form of research. That can range from doing clinical trials, that can range from analyzing large databases, or you may want to be in the lab and do more molecular type drug discovery or other avenues in that area.
Dr. Mark Russo, thank you so much for coming by and joining us.
You're welcome. Thank you for having me.
This is DDW TV. I'm Ed Highland. Of course, you can find much more in the way of highlights on the channel, ddw.org. Thanks for joining us.